Managing the symptoms of neuroendocrine cancer is key to living well. Our next speaker, Dr. Heloisa Soares, will discuss managing symptoms and enhancing daily life. Dr. Soares is a medical oncologist with a focus in GI and neuroendocrine cancers. She is an associate professor at the Huntsman Cancer Institute at University of Utah, where she leads the University of Utah NET Destination Care Program.
Hello, everyone. My name is Heloisa Soares. I'm a medical oncologist here at the University of Utah at the Huntsman Cancer Institute. And I'm here to talk to you about managing symptoms and enhancing daily life in patients living with neuroendocrine tumors. Thank you for having me. So first of all, as my disclosures, I do some consulting for these companies that are listed here, but they are within the rules of conflict of interest with my university. So what are we going to cover today? We are going to cover common symptoms that patients living with neuroendocrine tumors experience, some nutritional strategies, how to manage GI symptoms, issues related to pain management, why patients might have pain, and some daily wellness tips. So let's start with symptoms. So there's a lot of symptoms that patients with neuroendocrine tumors can have. The most common ones that we see are diarrhea, stomach pain or cramps, flushing, that's the face turning red, feeling super tired, changes in the weight or the appetite, that you're losing weight and you don't have appetite. There's also occasionally some patients might gain weight related to some of the hormonal secretion that some of the tumors might have, and pain. And you can see here, I just put a table that was published with some of the symptoms that patients experience, and that was done, collected this information through the Income Alliance. And you can see there's a lot of symptoms, and many of them we already talked about it, and you might have experienced or are experiencing. So you're not alone if you're having these symptoms. There is also a lot of misunderstanding on the symptoms that patients with neuroendocrine tumors might experience. How many times patients were to their doctors and healthcare professions teams and say, I'm having some weird diarrhea, and then the healthcare professional probably said, oh, you have IBS or IBD, or oh, I'm having flushing, and they say, oh, you're a woman in your 50s, this is perimenopausal. Or palpitations, you're experiencing palpitations, and they say, well, this is just anxiety, right? And this could be also, a lot of this could be related to your neuroendocrine tumor. And there's a lot of misunderstanding because it's a rare disease. Not everybody takes care of this disease until the diagnosis is done, and then you finally have some answers for the symptoms that you have been experienced for years. So it's not uncommon that patients feel frustrated that they don't have answers for their symptoms. Why do the symptoms happen? There are different reasons why, and that's super important to understand why a symptom is happening, because then you can treat properly, right? And hopefully decrease the amount of the symptoms. For example, tumors can cause hormones, and if the tumors are secreting hormones, then you will have symptoms related to that, and we will talk a little bit about in a minute. There's also issues related to the treatments or surgeries that can affect your digestion. Tumors can press in organs and cause pain. There are medications that can cause side effects. So let's start with the mechanical issues that can happen because a lot of tumors might be present. So for example, in the bigger picture that you have with the liver, you can see some of the white spots that are actually metastases or tumors in the liver that are pressing next to the edge of the liver, and that can cause pain. Which is capsule pain. So that we can treat with medications, but sometimes with liver embolizations, because that could decrease the size of the tumor that's pressing the capsule of the liver and therefore improve pain. There is also, you can see some pictures of a bowel. There's a picture that shows that a tumor is growing in the bowel and is causing obstruction. So patients will have a lot of symptoms related to feeling, if they eat something different that might irritate more, they'll have nausea, occasionally watery diarrhea, and can even vomit with cramping, and that can go on and off, having episodes like that through the course of years before finally the diagnosis of a tumor that's causing partial bowel obstructions is made. There is also, if someone has a mesenteric mass or that is in the middle of the belly, and you can see here with the arrows in yellow, that can cause a lot of issues as well. It can trigger some partial bowel obstructions as the symptoms that I already mentioned, but can also cause some ischemia of the bowel. And then every time that you eat, you will have really a lot of abdominal pain with eating and some diarrhea as well. So these are some of the symptoms that the tumors per se can cause. Then we have the issues related to symptoms associated with hormonal production. Not every single neuroendocrine tumor is going to produce hormones, but there's a subgroup of them that will. And if they produce serotonin, patients who have carcinoid syndrome can be flushing, abdominal cramping, and diarrhea. If associated with that, they also develop carcinoid heart disease, then they'll have low extremity edema. But there's many different hormones that neuroendocrine tumors can produce, and they're not going to produce all of them at once. They typically just produce one or another. And occasion, particularly with pancreatic neuroendocrine tumors, sometimes they switch the type of hormone that they will produce. So if a pancreatic neuroendocrine tumor or a duodenal neuroendocrine tumor is producing gastrin, then patients will have a lot of heartburn, ulcers in the stomach and the duodenal, and diarrhea. If the pancreatic neuroendocrine tumors are producing insulin, then the patients will have significant episodes with low blood sugars that they will really feel extremely bad and sick. If the tumors are producing ACTH, then the patients will gain weight, will have issues with a lot of electrolyte imbalances with, for example, the levels of potassium being very high, sugars will be affected, they'll have a very swollen type of face as well. So different tumors can produce different hormones, and that's why it's so important to really discuss with your healthcare team all the symptoms that you're experiencing, because then your healthcare providers or clinicians will do the appropriate workup to try to identify which hormone could be associated with your symptoms. But there's also side effects of the treatment, particularly with medications. So diarrhea, there are many of the medications that can cause diarrhea for different reasons. The hormonal shots, the somatostatin analogs known as somatostatin or lanreotide, they can cause pancreatic enzyme deficiency, which will translate in mushy stools and bloatness. Decreasing the appetite. Many of these treatments will make you lose your appetite or feel like the food doesn't have any taste. Chemotherapy, when patients are taking chemotherapy, is a very known side effect from it. Fatigue can be from medications, but can also be from the disease rash. Some of these treatments can cause rash. Infections, if you're receiving a treatment that can decrease your blood counts, then you are potentially more susceptible to infections. Hand and foot syndrome for some of the pills, such as cabozantinib, or chemotherapy pills, such as capecitabine, can cause the redness and the feeling of the blistering in the hands. We talked already about the low blood counts and nausea and vomiting, but most of this tends to be manageable as long as you really keep an open line of communication with your clinician and let them know that you're experiencing X, Y, and Z side effects. There are tricks that your physician can use to navigate the side effects and hopefully make less difficult to tolerate and hopefully very manageable. So it's important to really report all your side effects or any new symptoms that you are experiencing to your team, and then they will do the troubleshooting with you. Headaches is another one, especially we see a lot of this with some of the somatostatin analogs. So managing the diarrhea. Since diarrhea is such a big topic and symptom for patients with neuroendocrine tumors, there are two things that your healthcare team should think about. It. One is treating the symptom in general, which is starting typically with taking anti-diarrhea medications such as loperamide, which is Imodium. There's other medications that can also be used, and obviously stay hydrated and replace electrolytes. But then that you also have to treat the cause. So if your diarrhea is because your tumors are producing serotonin, therefore you have to treat that. And then one of the ways to treat that is using the hormonal shots or the somatostatin analogs. Every time that you try to control the disease, hopefully they will help also to control the functional symptom in this case. But there are times that because you resect a part of your small bowel, you might develop diarrhea from that, or you remove your gallbladder, then there might be diarrhea from that. And there are medications such as the bioacid binders that can help with treating that. So there's just the plain treating the symptom with anti-diarrhea medication, but there's also then try to understand what is the cause behind that symptom and treating that cause. You have to feel comfortable talking about your poop. And I sometimes ask a lot of questions about poop to my patients, and they look at me like I don't like this conversation. But it's super important because depending on what you tell me about your poop, I'm going to treat you differently. Are you having watery diarrhea or is more mushy? And why is that? Because if you're having a lot of watery diarrhea, particularly in the middle of the night or the mornings, I say, okay, this is probably more like related to hormonal production, and then I need to try to decrease the levels of serotonin or 5-HIA that your tumor is producing. But if you tell me that no, actually my diarrhea is actually more of this mushy stool, oily, yellow, I see it floating, I'll say, I think this is actually because of pancreatic enzyme deficiency, either because you had surgery from your pancreas, so your pancreas is not producing enough pancreatic enzymes to digest the food, or because you're receiving a somatostatin analog, which we know that could be one side effect. And the treatment would be different. If I think this is related to pancreatic enzyme deficiency, we're going to give you enzymes to replace it, which the one that we commercially use and is known is called Creon. And depending of the conversation about the poop, there are different strategies that we'll do. And I know that this is a busy slide, but just to give you an idea of what your healthcare team is thinking about when they're talking to you about diarrhea. And please be patient with them and answer their questions. And if you don't feel comfortable talking about poop in front of your family and friends because they might be in the room, it's perfectly okay to ask them to leave. And I don't think anyone will be hurt about that. Bloating, gas, and nausea is all super common. So some of the tricks is eat slowly and chew well, avoid soda and frizzy drinks, try to do some walks after the meals. If there's a lot of nausea involved, talk to your team to get some anti-nausea medications. Eating well can be hard because of different issues, but we should try. And we always tell patients, eat small and frequent meals, really try to chew the food well to be able to, for your body to digest. Use a little bit of water when you sip water to, again, be easier on your body. Avoid greasy, spicy, or any trigger foods that you have. And listen to your body. There are some well-known foods that might trigger side effects or reactions. In terms of carcinoid syndrome, we know that alcohol and cheese, particularly aged cheese, can trigger a lot of the flushing. So pay attention to your body. And if you identified a food that is triggering symptoms, try to not eat them. And then talk and consult with a dietitian. Many of the cancer places that we have, institutes and cancer centers, they typically will have a dietitian that you can consult with. Fatigue is a super hard symptom that everybody experiences to different levels. And it can be from the treatments, from the cancer, is from stress. And it's hard, right? Because people say it's an invisible symptom, and it's hard for others to understand that you are tired. But it's important to try to navigate that. And what are the ways that I try to help my patients with that? I know they might be counterintuitive, but you actually have to exercise. You have to take small walks every day, and they don't have to be 2-hour long walks. You can do 5 to 10 minutes. You should try to stretch or do yoga chair or Pilates, whatever type of exercise that you can do. You can try to keep some of the activities in the house, like house chores. You can try to do some of that. And then I always ask my patients, are you doing the yard? Are you doing the dishes? Try to continue to do some of that, because that you're physically moving. You have to move even if you are tired, and just do a little bit every day. And when you exercise, you feel better and you're going to feel less tired because of some of the hormones that we produce when we are active. I know that's super hard to start. Typically, I say we have to start slowly and just be consistent. You probably can try to see a strategy that makes sense for you, either by finding a buddy that you're going to exercise every day, or putting an alarm on your watch to go do things. But if you do not create the routine, you're not going to do it. So please see how your life is and decide what's the best strategy for you. For me, I know that I have to do my exercises early in the morning, because later my day goes by, and then when I get home, I am too tired to do anything at 9 or 10 o'clock. Plus, if I exercise at 10 o'clock at night, I cannot sleep, and sleeping is super important. So figure out with your lifestyle what makes sense for you. But create a routine. And again, you have to be consistent. And in the beginning, you just do small portions, but you have to do it. Even if a day you're just going to do it for like 2 minutes, that's better than nothing. So consistency in trying to get yourself moving. Don't forget your sleep and your spirit. Sleep is super important, and keeping your mind healthy is also super important. And don't forget about your caregivers. Please be thankful that they are there for you, and allow them to also take care of themselves. And perhaps they can be your buddies to get you a healthy routine. So I just want to end with my take home points, which are: do not assume that your symptoms are caused by a particular reason. Sometimes there are many reasons, so you just have to talk to your clinicians, discuss in detail with your healthcare team, take the time to talk about your symptoms, write notes, make points, and ask questions. Be patient. Sometimes we are not going to solve the issue right away. There might be a lot of conversations and adjustments, particularly if the reasons for your symptoms are multifactorial. They can be several things that are causing one symptom, such as the fatigue. Encourage the addition of a supportive care expert in your healthcare team, like palliative care or supportive oncology. They can be with you in any timing of your journey with neuroendocrine tumors. We can live well with this disease. It's just we have to be patient, we have to respect our bodies, and we have to have open communication with the healthcare teams. But it's possible to have a good life even when we are living with neuroendocrine tumors for most of the time. And don't forget you're not alone, and seek support, and find a group of people around you that understand you and support you. We know that keeping a good, positive community around us is super impactful and can make a difference on our mindness as well. So keep good people and supportive people around you. And I think that's what I have. Thank you so much for having me, and I hope you can take some tips from this talk and start living well with NETs.